Okay guys, so in this video we're going to go through some neural glider exercises for a patient lying in supine, and then we're also going to do it in a slump position as well. So what we're going to do for this one, we're just going to get you to bend your knee, Patrick. Just hold underneath the leg. So if you bring your hands up underneath here and just get you to hold. Usually I would go about 90 degrees, and then again it's as simple as 3 different ways we can do this one. So what I'm going to get you to do first, Patrick, is just keep a plantar flex position, so keep the ankle like that, and then just extend the leg for me. Good. Good, perfect. And then we just go off and on with that stretch. You wouldn't hold the stretch. Then if we wanted to make that harder, we could go dorsiflex position, and same thing. Makes it more difficult. That's good. We could then add a little bit of head tensioning as well. So what I want you to do this time, Patrick, is keep that same dorsiflex position, and as you come up, just bring the head up towards your chest for me. Okay, so we're tensioning from the top and we're tensioning from the bottom. And the other thing I quite like to do as well, and relax, is you can mess around with the hip position in terms of more abducted, more adducted. I often find the more adducted position for people is different. So again, in this position, Patrick, same thing. So it's often a bit more difficult, again, because you've got that where the nerve comes is being stretched a little bit more. And then you can mess around a little bit with foot positioning as well. So you can get more of a inverted position, same thing. So keeping that foot there, yeah, perfect. Or a more everted position of the foot. So depending on what you found in your physical assessment, you can bias the neural stretching or neural gliding to whatever position you feel you want to. And often I like just showing patients a few different ways and just say to them, vary it. So vary the way you're stretching, vary the way that you're working on that nerve, because again, I think that is always helpful to get variability in movement. And then what we could do is a slump position. So if you come up into sitting for me, facing towards the camera, and then sitting all the way back, slide yourself back so the knees are on the edge, hands behind your back, and usually again I would just get them into this slump position. Good. So what I want you to do this time, Patrick, is keep your foot dorsiflexed on the right hand side. So we're going to pretend the right side is the one we're working on, and you're going to lift your head up and lift the foot up at the same time. So we're going to get that glider going. It's a good gliding position, just maintaining the thoracic slump but adding on. Perfect. And then you could add, again, head down, plantar flex the foot, so point the toes down, and then same thing with the extending of the knee. So keeping that plantar flex position. And then we can add dorsiflexion as well. So this would be the hardest version because we're tensioning from the top and we're tensioning also from the bottom. That's good, and relax. So again, all these neural glider exercises you could use as a treatment while you're in session. You could also use as a really good home exercise, and they're just there to support this neural gliding of the sciatic nerve. Again, lots of other structures are being stretched and moved when you do that. These sorts of things I think are really helpful for neural tension type pain, when you have someone with poor flexion often and symptoms down the back of their leg. Often find these sorts of things can be really helpful. So that is your straight leg raise and slump positioned neural gliding exercises.